Welcome back, everybody. Michael O'Connor here. I'm a doctor of physical therapy. I've gotten many requests recently for ankle strengthening exercises. So today I'm going to review 3 primary strengthening exercises that I implemented frequently with patients. Many would come to me and say, I've done some ankle strengthening, particularly calf raises, and they don't seem to do much. I feel like my calves aren't working that hard, and I feel like I need to add weight to the exercise. That almost always was not the case. What I tended to do was correct form, talk more about your posture and alignment during the exercise, and most importantly, changing the tempo of each exercise. So I'm confident if you implement these strategies today, you will feel completely different during these strengthening exercises. And please stay tuned to the end because I'll provide the #1 take-home message that I want to make sure that you receive from this video today. And as always, please check with your medical team to make sure these exercises are appropriate for your specific situation. Safety first. Let's take a look. For the setup, you just need something stable in front of you, a chair, it could be the wall, countertop, something that's not going to move. Starting position is a small, tiny hip hinge. My back stays flat, my abdominals are tight, my shoulders are back, my neck is in neutral. My feet are a little bit closer together than shoulder width. And what I'm going to do is I'm going to lift my heels and I'm going to maximize the height of the heel lift. I'm going to hold it for 2 or 3 seconds and I'm going to lower myself down twice as slow. When I get to the bottom, my heel taps the ground and comes right back up. Hold, 2, 3, and down slow. You may remember the lowering is called the eccentric. Heel tap, right back up. Hold, 2, 3, back down. So a couple things I'm thinking as I'm going through these repetitions. One is maximizing the height. We often cut this exercise a little bit short, but the calf needs the full range of motion of the strengthening. The second thing is we often drop down and lose the controlled eccentric, the controlled lowering of this exercise. The calf muscle gets so much work controlling our body weight downward. So make sure you focus on that lowering at a slower pace than the lifting. When I'm at the bottom, I'm also not resting. I'm continuing to keep the contraction in my calf, which provides more endurance and it works the muscle a little bit more vigorously. And it's lift, hold, 2, 3, down, twice as slow. Heel tap, lift, 2, 3, down, twice as slow. Couple things to avoid. When you're lifting, it's very common to see individuals hyperextend their back trying to maximize the height. Don't strain and try to get that much height that you lose your posture. Remember, you have to keep the slight hip hinge and your abdominal tension throughout the motion. The other thing you don't want to do is come up and drop down, as we discussed. Up, down, you can do probably 100 of these and you probably wouldn't feel much. The other common thing we see is the pace is just too fast and there's almost like a rocking motion using momentum to do the exercise versus the actual calf itself. So be careful of those. When you perform this exercise at that pace and that tempo with this form, it's challenging. 2 to 3 sets, maybe 5 to 8 repetitions. Watch the speed of this one and really make sure you feel it where you should. And that should be in the upper calf. It's called the gastrocnemius muscle. Make sure you're isolating this where it should be felt. The front of the shin is a very important muscle called your anterior tibialis. That's really important as we're bringing our leg through, that we have strength and endurance in that muscle so we don't end up catching a toe. So the anterior tibialis shin muscle is often way understretched and rarely ever trained. You can train this muscle if you have a strap and a resistance band. You can also use a flatter elastic band if you have that equipment. But to keep things simple, I'm going to use a grocery bag and a couple cans for weight. That's all the equipment that I'll need. So I place the cans in the bag. I did tie the top of the bag so that it fits over my shoe, and I definitely want to wear shoes for this so the bag's not slipping. Just need a chair, an ottoman, or a second chair, or you can do this off the edge of your bed. But make sure you have good back support. So I've looped the bag around the front of my foot, abdominals tight, my shoulders are back, my head is in neutral, always think in posture. I have good back support. My leg is gonna stay straight. I'm gonna do a light quad set, so you're gonna get some additional benefits of thinking of your posture and your leg position. And I'm gonna let the weight of the cans drop my foot down. Give it a few seconds to stretch, and I'm gonna pull right back toward me. Trying to pull as far as I can without straining. Down twice as slow, pulling toward me. So remember, the lowering down is called the eccentric. We want to control that motion. Pulling toward me is called the concentric. Should take 2 or 3 seconds to pull the weight toward me. And 3 or 4 seconds to lower it down with control. When done correctly, you should feel this exercise right on the front of the shin. You can often see the muscle kind of pop up. It's got a good teardrop shape to it. And back down. 2 to 3 sets of 5 to 8 repetitions to start. See how it goes. As you get stronger, you can add additional weights. Couple things to be careful and make sure you avoid. As you're moving the ankle, my leg is not moving. You want to make sure you isometrically keep your leg in the same position and my toes are pointing toward the ceiling. So make sure that leg is stable as you can get. And second thing, watch the pace once again. If you do real fast repetitions, it can actually irritate the muscle and not isolate it for strengthening as much. Always think of your posture. Make sure you're not losing that through this exercise because we can get additional benefits throughout the body when we're thinking posture. Ankle eversion is the ability to move our foot outward. It's very important to train this muscle group on the outside of your lower leg because when we're walking, particularly on uneven surfaces, if our ankle rolls and tries to roll inward, which is where most of the ankle sprains occur, this muscle group is what contracts and prevents us from rolling and really having a serious injury. So let's take a look at the beginning exercises for ankle eversion. All I need is a pillow, and I usually wrap a towel around it since it's going to be toward the floor. These can be done with or without your shoes on. What I'm going to do is simply place my foot up against the pillow, kind of like I'm holding it to the surface that I have it pressed against. And I'll start with my ankle at a right angle, 90-degree angle. What I'm going to do is take my pinky toe side and I'm going to push directly outward. So it's this direction. That's eversion. Push out, hold, 2, 3, and back in. Push out. If you do this exercise correctly, you should feel that pretty quickly on the outside. Push out and relax. One of the reasons I like this exercise so much is because you want to vary the angle of your ankle because remember the sprained ankle often occurs when your toes are down. You want to work various angles, maybe a right angle, a little bit toward you, and definitely progress and work most regularly with your toes in the downward away position of eversion. Here's a front angle for you, pushing outward and relax. Push out, hold, 2, 3, controlled relaxation. Couple things you want to watch for and avoid. Your leg isn't going to move as you're doing this exercise. Make sure you're not using your hip abductors. The other part is watch your toes. Sometimes when you push outward, they try to extend up towards you. Try to keep your toes in a very relaxed, neutral position. That means they're not curling up toward me and they're not curling down either. For me, the number one thing that I helped most patients with was correcting their form and talking about their alignment and posture, but really it was that controlled release of the muscle contraction. Remember, it should take 2 or 3 seconds to contract a muscle, but 3 or 4 seconds to control the relaxation of that muscle. So I recommend go back to all your exercises, slow things down, focus on the contraction and the relaxation of the exercise, and see how it implements and makes every exercise more effective for you. I hope you enjoyed this video. Please keep subscribing, share these videos with your friends and family, and leave those comments. I'm reading them and I am implementing content based on your comments. Thanks for tuning in, and we'll see you soon.